Our political editor, Craig Patrick, is here to put this in perspective for us. Hi, Craig.
Well, hi there. We're certainly living through an unusual health crisis right now. And with that, we're seeing some new government rules that are drawing a mix of praise and opposition. But this certainly is not unprecedented, and it certainly is not new. With different kinds of health threats, we've actually been through this many times before.
This is a pandemic of the unvaccinated. And to make matters worse, there are elected officials actively working to undermine the fight against COVID-19.
The president's opponents claim his new vaccination mandates are unprecedented. And as Ohio Republican Congressman Jim Jordan put it, un-American. George Washington, though, would disagree. The year after we declared freedom, the father of our country addressed the smallpox crisis by mandating smallpox vaccines for all of his soldiers. Accounts in the Library of Congress note Washington defeating the British was impressive, but simultaneously taking on smallpox was a risky stroke of genius. As the narrative state Washington committed to the unpopular policy of mass inoculation, he faced resistance from politicians in Virginia who banned vaccine requirements and were proven to be on the wrong side of history. In a letter to his brother, Washington wrote, "Restraining inoculation can never be continued," and that he would rather move for a law to compel families to inoculate every child under severe penalties if they don't. There are some striking similarities in Washington's words then and Biden's words today.
And a distinct minority of Americans, supported by a distinct minority of elected officials, are keeping us from turning the corner.
As the United States took off, so did vaccine mandates, and they were far more forceful than anything Biden is doing today. In the late 1800s and early 1900s, officials went door to door inoculating people by force. A pastor named Henning Jacobson sued, claiming the freedom to not be vaccinated. And in 1905, the Supreme Court ruled against him 7-2. That set the legal precedent that government in the United States does have the right to mandate vaccines in the interest of public health. Justice John Marshall Harlan wrote the U.S. Constitution does not give people the freedom to disregard public health measures when doing so may harm others. Opponents like Charles Michael Higgins raged, protested, and spread false claims about vaccines in groups like the Anti-Vaccination League of America. It faded after he died, and when future crises came along like polio and measles, vaccine mandates did not face much resistance. Most Americans regarded vaccinations as a matter of duty or personal responsibility. And by the 1970s, all 50 states mandated a range of vaccines for all students in order to attend public school. And those are still in place with little opposition. With respect to the new rules, the president is ordering all federal executive workers and federal contractors to get vaccinated with no opt-out except for religious objections and for certain disabilities. There's a 75-day ramp up for that. At the same time, he's requiring all healthcare providers who serve Medicare and Medicaid patients to get vaccinated. If not, their providers will lose funding. That, therefore, is moving very quickly as we speak. And also, he is calling on the Labor Department to draft a new rule that would require all companies with 100 employees or more to require all of their workers to either get a weekly COVID test or to get vaccinated. And that's based on a 1970 law that gives OSHA far more power to regulate health and safety in the workplace. So we will explain that law, the compliance capabilities the federal government has, and how this all comes together with the time frame and what more we can expect in the weeks ahead. All of that is coming up at 5 o'clock.
Well, that historical perspective was very interesting, Craig. Based on polling today, what is driving much of today's resistance to vaccines among those who haven't received it yet?
Yeah, among the holdouts, there are a couple of reasons, but the biggest by far, based on national surveys, would be concerns about the risk of getting the vaccine. And when you dig deeper into the questions, it shows that people have concerns that are based on disinformation or misinformation. It certainly doesn't line up with the majority of the scientific and medical community.
All right, Craig Patrick, we'll hear more from you later on today. Thanks.